My patient called me a liar today, and I ended up escorting him out of the exam room. Probably thinking that must have been a terrible interaction, and it was. But here's the thing though, the science was about to prove the real story. Today I'm going to show you how industrial hygiene, air sampling, and something I call exposure delusion completely changed this workers' comp claim. I'm Dr. Leslie Cadet, an occupational and environmental medicine physician and the founder of Ascend Occupational Medicine Consulting, where we help self-insured employers lower their work comp costs through medical oversight that works. So this worker was convinced that his office building was making him sick. Not concerned, convinced. And not just one office building, 3 different buildings and office spaces where he had been moved over time due to employer needs and his complaints. Congestion, eye irritation. The building is sick, he told me. Now I want to take a moment to say that yes, sometimes a building is sick and is legitimately causing people to become sick who operate within it. But there's also something called exposure delusion, which is where someone becomes convinced that a workplace exposure exists despite objective evidence showing otherwise. Now notice what I didn't say. I didn't say the symptoms aren't real. I said the perceived cause and the actual cause may be very different. So instead of guessing, we did what medicine should do. We tested. We brought in industrial hygiene experts and performed air sampling in every area where he believed he was being exposed. The results surprised him. The same mold, pollen, and dust that existed outside were present inside the building, which is completely normal. But the concentrations inside the building were more than 20 times lower than outdoors. So that means the ventilation system was doing exactly what it was designed to do, filtering particles, reducing exposures, protecting the occupants. But there was another piece to the story. According to him, Human Resources told him to file a work comp claim. According to his supervisors, he had previously requested to work remotely and had been denied. Relationships with his coworkers had become strained. He had even begun placing his own mold testing devices throughout the office. Meanwhile, I temporarily restricted him from working in the areas he believed were causing his symptoms. 6 weeks later, I asked him how he was doing. No better, he said. Then he casually mentioned something that changed everything. When I sleep with my windows open, my symptoms get worse. Bingo. Because with the windows open, he was exposing himself to outdoor air where mold, pollen, and allergens existed at concentrations far higher than anything measured inside of his office building. The problem wasn't the workplace. The exposure was outside. And that's when he called me a liar. You see, patients don't come in with data. They come in with beliefs. And sometimes frustrations, workplace conflict, unmet expectations get intertwined with the symptom reporting. And my job isn't to pick sides, it's to follow the evidence. So here's a takeaway for employers. If someone reports an environmental illness, don't assume. Test, measure, verify. Because healthy buildings protect people more than employers realize. And industrial hygiene is a beautiful thing, especially when you are dealing with exposure delusion. Like, subscribe, and comment if these breakdowns help you understand how work comp claims actually escalate. Register for our upcoming webinar. The problem isn't the injury, it's the lack of medical oversight. And if you're an employer or a risk leader trying to make smarter decisions earlier in the life cycle of the claim, book a call with us to see how our medical governance program can help your self-insured program.